Hello, my name is Alexandria Harris, and my informative speech is on tattooing. Think before you ink. Tattooing has become increasingly popular, a form of body art. According to the Pew Research Company, it is estimated that 36% of Americans aged 18 through 25 report having a tattoo. However, getting a tattoo may create various health problems ranging from potential reaction to potential infection. For a moment, imagine that you were 18, you're with your friends, and you were all going to get a tattoo, a brand new tattoo, your first tattoo. You are now at the tattoo shop, you're in the chair, and your tattoo artist is going over with you your design. An hour later, you're done. You love it. You love your brand new work of art. Now, imagine 1 week later, you break out in a horrible rash within and around your brand new tattoo. You're shocked. No one told you this could happen, not your friends nor your tattoo artist. What happened? How could this happen? I became interested in tattoos at the age of 18. I became particularly interested in tattoo reactions after my 7th tattoo, when I had what is known as the red ink reaction. The red ink reaction causes your skin to swell and sometimes weep and sometimes open up. Preceding the reaction, I had an infection in my tattoo, which left my tattoo colorless. Today, I would like to share with you some of the things that I've learned post-tattoo reaction. First off, I would like to begin about talking about what getting a tattoo involves. A tattoo is a puncture wound made up deep in your skin. The tattoo ink is injected into the dermis, which is the second, deeper layer of skin. The dermis cells are very stable. The tattoo is practically permanent. Many people with tattoos often have experienced some type of tattoo reactions. Tattoo allergic reactions are common. The skin may become red, slightly swollen, and irritated at the site of the tattoo. This occurs because of the irritation of the tattoo needle and the tattoo ink. According to the American Academy of Dermatology, allergic reactions are one of the most common problems associated with tattooing. One of the most common causes of allergic reactions are tattoo inks. Tattoo inks can be made out of a variety of things such as copper, calcium, iron, and phosphorus. Red and yellow ink may contain pigment, azo, silica, titanium dioxide, and other commonly used chemicals that are found in printing and car painting, according to the American Academy of Dermatology. The color red, this may give people problems more than any other color. Red is often made from mercury, and that the problem with the red is that a lot of people are allergic to the mercury. It is estimated that between 1% and 5% of the general population is allergic to mercury. This here is a picture of other ink reactions. This one in particular is a reaction to black and blue ink. Here, and it looks like a little bit of the purple, as you can see the small nodules in the picture here.
Ugh.
Are you still thinking about getting a tattoo? If you're still thinking about getting a tattoo, which looks cooler than a scab, keep in mind that the new tattoo is also a wound. And like any other scrape or puncture or cut, your tattoo can put you at risk for infection or disease. Signs of infection you will see or feel redness, spreading redness, excessive swelling, excessive pain, bleeding, and changes in the surrounding skin, and pus-like drainage, as pictured here. As we can see, the changes in the surrounding skin increasing and the increasing redness. Keep in mind that not all of these signs appear at once. Some common infections are staph, hepatitis B, and microbacterial infections, such as the one that happened here. Microbacterial infections result from water contamination within the ink or when diluting the ink with non-sterile water by the tattoo artist before use. To prevent this, the Center for Disease Control recommends that only sterile ink products and sterile water should be used, and appropriate hygiene practices should be followed when tattooing. Now that we have talked about some possible things that can happen after getting your tattoo, let's talk about some things that we can do to prevent these reactions. It all starts with you. Are you up to date on your immunizations, especially the tetanus shot and the hepatitis B vaccine? These are particularly important because you're exposing yourself to tetanus by introducing the needle within the skin, and you're also exposing yourself to hepatitis B, which can be transmitted through tattooing. Next up, make sure your skin is clean before getting your tattoo. After that, you want to make sure that the skin around your proposed tattoo site is intact. Remember, an open area puts you at more risk for infection. And lastly, follow your aftercare instructions. After getting your tattoo, follow all of the instructions that the tattoo artist gives you for caring for your tattoo. That includes washing it, cleaning it, applying the ointments, keeping it covered out of the sun, things of that nature, which are important in protecting your new tattoo. Second thing, clean shop. When doing your consultation with the tattoo artist, ask the artist questions. For example, how are your instruments clean? Insist on seeing your sterile packaging, the equipment in a sterile package. Ask him, has he had anyone report an ink reaction to you lately? Ask him what type of water that he uses when diluting his ink. Anything to make you to help you to make a better informed decision about getting your tattoo. Artist communication. Ask about the risk again. And if you have experienced a risk, give your artist feedback. Let the artist know that you've experienced a risk or experienced a reaction to possibly the ink or maybe some of the materials that were used during your tattoo. That all being said, is getting a tattoo really worth it? For some people really enjoy getting their tattoos, and they are happy to keep them for their life, whereas others might regret getting the tattoo that they acted on impulse and didn't think about it long enough before they got one. Getting a tattoo is a big deal, especially since they are designed to be permanent and could possibly create various health problems, such as, again, allergic reaction and potential infection. If you've thought about it and you've decided to get your tattoo, be a detective first. Do your homework. Make sure that the tattoo shop that you're going to is clean, their equipment is properly packaged, and that they're using adequate materials. Also, remember that getting a tattoo requires you to be more responsible to the skin that is getting the tattoo. You want to make sure that you keep the skin clean, intact. You want to make sure that you clean the skin as directed after getting your tattoo. It is up to you to protect yourself from any infection or possible allergic reaction. before and after getting your tattoo.